Real generosity towards the future consists of giving all to what is present.
People should look into some of the sufferings of these poor people and give them help. Blessing also comes from there.
I got married to a person who has almost the same vision that I have of helping. So that's basically what prompted us into helping people, getting involved in anything that will make the life of human beings better, or making the community, or even our state.
Building futures today is how best to describe the activities of the Godwin and Patricia Okeke Foundation, GPOF Nigeria. Founded over 30 years ago, is a multidisciplinary non-governmental organization, NGO, with 3 core areas: to empower the youth through proper education and professional development opportunities, to impart entrepreneurial achievements in underserved communities through startup grants and loans, to actively contribute towards the improvement of healthcare provision and human development. The foundation has, among others, donated to natural disaster victims, erected educational infrastructure in universities and classroom block in a school for physically challenged children, given numerous scholarships to students studying in Nigeria and abroad. Determined to give more back to the community, in 2010, GPOF partnered with Rise Global Health Initiative, a US-based organization focused on developing community-based independent health systems globally. Together, the partners established the Rise Go Pat Healthcare Foundation, Nigeria.
We looked into the health problems of our people. Most of the big men in this country, we travel abroad for medical treatment. Some go to Ghana, some to India, some to UK, US, Germany for medical treatment. And in most cases, you see that our people, they travel abroad for minor treatment. Minor, the things that could be handled within. But at times, because of inefficiency of some of our people, you go to the lab, they will tell you it's malaria and typhoid every corner, without going into details. We felt, okay, since we have the opportunity of going abroad to have this treatment, and we know what it's all about and what it entails, that it will be better for us to develop something of that class here.
Since its inception, the Rise Go Path Healthcare Foundation has invested over $2 million in Anambra's health system, starting with numerous health awareness campaigns. The foundation's greatest achievement is in the development of the first comprehensive health campus in the Anocha local government area called Rice Clinic Nigeria, Adazian. Rice Clinic has increasingly contributed to access to care, economic development and capacity building of Anambra State.
At the time, my interest was focusing in healthcare education, pharmacy schools, medical schools. How do we bring students out and how do we show them the way things are done outside of Nigeria, and hopefully they can bring it back to serve their own people? And how do we also get students from over there to come and see what tropical medicine and be able to work with us to come up with solutions for our people? But it didn't take us long to realize that it wasn't enough doing the education. It wasn't enough sending people to go see how things are being done, that we needed a model facility where they could actually learn, where they could actually understand and be able to try different things out. So that was when the idea of a healthcare institution, which is today, luckily Rice Clinic Nigeria, that was how the idea came about. How do we create a place where anybody from any religion, from any cultural background, from any tribe, from any class in the society who has a real and genuine interest in improving healthcare can actually come and learn and participate and be a part of the solution.
It has created over 150 jobs in the community, provided over 4,000 hours of professional development, provided comprehensive health services, including general primary care, clinical imaging and laboratory diagnostics, pharmacy services, maternal and child care, and its most recent development in surgical and acute care services. In collaboration with other local and international partners, the Rise Go Path Healthcare Foundation has been able to recruit and manage over 345 local volunteers from 3 of the 6 geopolitical zones across Nigeria, and over 100 international health professional volunteers across the US and UK.
We have, our poor people here don't have the finances to go overseas. So we look for a way to bring that technology back home.
Rise Clinic is looking to overall lift up and raise the standard for healthcare in Nigeria. Is a true dream and vision.
As part of the community impact, Rise proudest community programs include a week-long health fair in 2012, Anambra Free Clinic Days in 2013, and an epilepsy screening event within the same year, targeted at a non-communicable disease highly misunderstood and stigmatized in Nigeria. In 2013, in collaboration with neurosurgeons in the US and Abuja, Rise implemented Nigerian Epilepsy Care Advancement Program, where 240 epileptic patients were diagnosed and provided free treatment for a 12-month period, in hopes that they will gain control of their seizures and reintegrate into society by keeping steady employment and going back to school.
But one of the lessons we learned from that exercise is people had the wrong notion about epilepsy. They said it was contagious, some of them said it was voodoo, some of them said maybe their parents had done something in the past. But we were able to show them with the right education you can help someone with seizure. We were able to show them with the right medications you can have a normal life just like everyone else. With the right medications you can actually get a job, be able to provide for yourself and contribute productively to the community. So I would say all in all is a wonderful idea, a wonderful partnership, and our first activity into actually identifying some of the issues that people did not want to talk about, because we realized that epilepsy had more stigma than HIV. And we're happy to say today it's actually been one of our best programs. We have people coming from Bayelsa State, Delta State, Enugu State, Imo State to receive medical care.
The management model adopted by Rise identifies the health and social needs through provision of appropriate health-seeking behaviors, which mean patients are being serviced at the right setting for their care and identifying various health financing mechanisms to help subsidize the cost of healthcare. This model, piloted at Rise Clinic Hadaziani, is referred to as the Rise Integrated Healthcare Delivery Model, which the foundation hopes to be a template for other health facilities in the state.
When we started, we had a vision for healthcare integration, so what we call the Rise Integrated Healthcare Delivery Model. The idea that we can integrate healthcare in various settings to decrease the financial burden on individual patients as well as the whole health system, as well as increasing the clinical quality that patients receive. So we really emphasize patients receiving the right care at the right setting and at the right price, because healthcare is not just about the clinical side, the clinical quality of what's being provided to patients, but it's a fine balance between the financials and affordability of it.
The model emphasizes providing 3 key areas of healthcare: the community level, the ambulatory level, and the acute care level, and being able to triage patients to the proper level to minimize cost to patients while providing the appropriate services for each individual disease level.
But our idea is if we can start from the community and do population screening, if we can come to the community and educate church groups, women groups, and empower them on ways to mitigate health risks, ways to address these things before they get to needing to go to a hospital, that will be saving a lot of lives. And as such, we've done a lot of outreach programs. We continue to engage local women groups and local organizations and local church groups, teaching them, providing screenings and getting them to understand the basic things they can do to be better. Our goal is if we can arrest these things at the community setting, It reduces the burden on the hospital setting and also reduces the economic costs of providing this medical care. But we also know that there's still need for the ambulatory setting. With a lot of the ancillary services, people want a good diagnostic lab, people want a good clinical imaging lab, people want a good pharmacy, people want to be able to talk to physiotherapists and things like that. We want to make sure those services are available so that they can support not just the primary care, they can also support the secondary care and, of course, more importantly, support acute care.
Additionally, the model takes into account health financing mechanisms such as national and community-based health insurance schemes, college and corporate health plans, and other forms of health insurance to reduce the burden of out-of-pocket payments on individual patients.
We need to start thinking about other financing mechanisms, whether instead of just looking at out-of-pocket payments, what other mechanisms can we tap into? So looking at different health schemes that can help alleviate the burden on any individual, community-based health insurance plans, educating the community that for something as low as 300 Naira a month, that they can cover themselves and possibly their family for any kind of accidental emergencies and healthcare services. So they would pay into a system for the working population. If you work in a company, there should be advocacy for your company to pay a portion of your health plan so that you're covered. For students, there should be advocacy for the institution, the academic institution, to pay for a part of this health plan. So there's a lot of different financing mechanisms, not just from the state budget or federal budget or international budget, but also things that we can do here on ground that can make a huge difference. So that's the essence of the model, being able to finance the healthcare as well as providing the quality healthcare.
Rise Health Corporation is employing the use of mobile technology for the advancement of a robust healthcare delivery system that will create a network for health workers in the state, giving them a link to advanced methods worldwide. Healthcare technologies such as telehealth services and other mobile services are the key linkage to enhancing healthcare in Nigeria and what will maximize the efficiency of the RISE integrated healthcare delivery model.
We need to plan things in multiple phases. Of course, what we like to say is the lowest hanging fruit first. Right now, things such as record keeping or just basic data transmission by traditional paper or just phone calls is actually not good enough. But with mobile technology, it's actually very possible to have things such as remote diagnostics, good inventory management, and just being able to reach out and share data with health experts around the world so that they have a chance to partake in the improvement of the overall healthcare here in Nigeria.
A specific RISE program currently in development is the Healthcare Micro-Entrepreneur Program. It will train, engage, and provide startup financing to community health workers to allow them to deliver trusted health services at the community level. This program will boost job creation and empowerment in the rural areas by creating a network of healthcare entrepreneurs who will operate in the rural areas, taking medical supplies to patients registered with the foundation.
The idea behind these healthcare entrepreneurs, we are trying to achieve two objectives for the healthcare entrepreneurs, which is one part of the whole program. Now, the service that we're providing is antenatal care. That way, these women have checkups before delivery, so there will be no complications towards the end. Now, the objective for these HMEs is we want to empower them by education and training to provide these services, to be a trusted healthcare provider in their community. Then also, we want to alleviate poverty, invest in these women, because for these supplies that they'll be using to go to home, it needs to be procured, and they need to sell it as to be sustainable. So in other words, the entrepreneurs.
In an effort to expand their healthcare model to other parts of Anambra State, Rise Health Corporation USA signed a Memorandum of Understanding (MOU) with the Anambra State government for the re-engineering of 4 pilot hospitals in the state. The MOU is worth $1.5 million, with Rise contributing 80% of the required funds. These hospitals are to be managed by the newly formed Anambra Business Coalition, ABC. ABC is a public-private partnership between the Anambra State government, Rise Health Corporation in the USA, and East West Pharmaceuticals. It is a health and wellness management and investment company aimed at enhancing Anambra's human and financial capital by directly targeting improvements in its health sector. ABC's initial efforts focus on hospital re-engineering and the formation of a health alliance across the state. Hospitals under the Health Alliance, which include Orumba General Hospital, Anambra South Senatorial District, Rise Clinic Adaziani in Anambra Central, Osamala General Hospital and Rise Clinic Onitsha in Anambra North. These health institutions will meet clinical and financial quality standards set by ABC. ABC Hospital Reengineering aims to create a foundation of high-standard public and private hospitals throughout Anambra State. This network of hospitals will allow for the development of reliable emergency services in which patients can access quick and reliable services anywhere in the state at any of ABC's hospitals.
I always say there's 5 key areas of re-engineering. The first is building renovations. So any health system, you need the basics. You need running water, you need electricity, and so that's what we want to focus on, the basics. The second is human resources. Like I've mentioned before, even more important than facilities is having a good workforce that really believes and is committed to seeing change. So really human resources management and training. The third is clinical and financial policies and procedures. So it's one thing to have the human resources, but is there a proper system for them to work in? So are there clinical protocols for them to follow? Are there financial protocols for them to follow so that as we go down the road, there's proper information to track whether it's flourishing or failing? And so that's the third key area. The fourth and fifth is really being able to source pharmaceuticals and medical supplies and equipment at a low cost.
ABC has completed the renovation of 3 of the 4 health institutions under the ABC Health Alliance. Rise Clinic Adaziani in Anocha local government area, Rise Clinic Onitsha, and Orumba General Hospital, Orumba North local government area. ABC is concluding plans to commence work on the 4th Osamala General Hospital, Obaru, in March 2017. As part of the ABC Hospital re-engineering, Rise Clinic Adaziani has been installed with a fully equipped operating theater to provide emergency and elective surgical services to the community. Through its clinical integration network, Rise will collaborate with independent surgeons across Anambra to deliver necessary surgical services. This will begin to develop emergency services to ensure comprehensive acute care services are available at this location. ABC Health Alliance fully established Rise Clinic Onitsha, which now offers qualitative healthcare services that include primary care, surgical services, and imaging. It has a modern lab and a well-stocked pharmacy. Rise Clinic Onitsha, located off Atibida Road, is at the heart of Main Market, Africa's largest open market, with thousands of shops and over 1 million foot traffic a day. This clinic's location is highly necessary to meet the high health demands of the population. Orumba General Hospital marks the first state-owned hospital to undergo the re-engineering process under ABC management. Within 6 months, Orumba General Hospital went from a facility with no perimeter fencing, no running water, lights nor basic resources to being a fully functional hospital with all the amenities, capable of providing high-standard healthcare to the community.
So over there in Rice Clinic, which we are trying to imitate, we do what we call post and pre-visit calls, whereby we call patients to remind them that, Mama, you are supposed to come to hospital on Monday. Papa, you are supposed to do this, you are supposed to do that. Even the pharmacy department also do that. If you go to the pharmacy department, we have all kind of drugs. Then coming to the lab, we have so many equipments. The one we have there that is the most expensive one is Cobalt C11 that runs thousands of lab tests at the same time. We have the centrifuge, we have the blood bank machine that is over there in the lab. So we have all it takes to get someone diagnosed in that lab. Then when it comes to the theater, we have our anesthetic machine. Some theaters doesn't have that. They use the local means of doing the anesthetics. But over here we have it. We also have our imaging machine, electronic digital imaging, whereby we can take the photograph of a particular body, send it to whosoever that is in any part of the country through email. The person can view it, the person can make any recommendation or any report and send it back to us. So these are some of the changes we've brought to Orumba General Hospital.
Today, this healthcare facility, built in 1957, has been completely re-engineered to deliver quality healthcare to the people of Orumba North and South and its environs.
What is happening today gives me joy that we have come to enjoy a medical institution instead of going to Newi or going to Oka or even going abroad. See, and I've looked at the pharmacy. It's completely reorganized, and drugs equipment there, unlike what government had to do since 1957.
It was pomp and pageantry on the 5th of November 2015 when the new Orumba General Hospital was officially opened by His Excellency Chief Willie Obiano with the entire community in attendance. The governor expressed his satisfaction on the project and said that he was prepared to go into further partnership with RISE on the other remaining 35 general hospitals in the state.
We are partnering with RISE Foundation on 4 of the 37 general hospitals. And one of the general hospitals is this Orumba General Hospital. You can see how it's turned out very well.
The modern equipment installed in Orumba, such as the computerized anesthetics machine within the surgical unit and the upgraded clinical lab, amongst others, lay bare the quality healthcare now being offered in Orumba. For the first time, the pharmacy is fully stocked with quality drugs and basic consumer goods, which are now affordable to the masses. Talking to patients who were delighted that they could now get Medicare close by, they said it was a relief that the Orumba General Hospital was now open to cater for their needs. Orumba General Hospital went from a facility seeing on average less than 10 patients a week to seeing over 64 patients in the first week since its commissioning under ABC's management.
Who would have even believed that the untutored Africa knows God? Nobody ever thought that people will ever come back here again to come and collect drugs or even have consultation with any medical doctor. We thank God who gave them the spirit, because no man does good to revitalize here. For people like us to come here and obtain medical services.
When I was passing by about last week, I saw there is a new work going around there, so I decided to check in and see what it was. So on my way getting in here, I saw that things are turning into new shape. I asked some questions and I saw that a new management seems to have taken over. So and I went home to bring my dad to see what they can do. And I'm very happy from what I've seen.
The Anambra State Rise Health Corporation USA collaboration is building healthcare facilities that will make Anambra the medical tourist destination in Nigeria.